Insulin Glargine, a long-acting insulin. This insulin comes in three dosage forms: a pre-filled pen, a pre-filled vial, and a pre-filled cartridge, which then can be loaded into the pre-filled pen and injected. While as for the pre-filled vial, the patient has to take the insulin using a needle and then inject it. So what is Glargine? Glargine is a insulin analog. It has been created from the recombinant DNA of E. coli, and few adjustments have been done to the structure. It has a similar structure of insulin with only few adjustments. The amino acid at the position 21 has been replaced by glycine, and the C-terminal of the beta chain, at the C-terminal of the beta chain, two amino acids have been added, or two arginines have been added. So the substitution and addition of amino acids have led into a more stable compound called, and more acidic compound called Glargine. So we use Glargine in type 1 and type 2 diabetes mellitus. In type 1 diabetes mellitus, in which the body does not produce insulin, and in type 2 diabetes, in which the body produces insulin but is unable to use it. We use it more commonly in type 1 diabetes, and when we use it in type 1 diabetes, we should also use it with a short-acting insulin. As we said, this compound has a similar mechanism of action to that of insulin because it has the same structure of insulin and it's an analog of insulin. So its mechanism is increasing the peripheral uptake of glucose by the skeletal muscle and fat, and also by inhibiting the liver from producing more glucose, thus monitoring or lowering the blood glucose level. The special thing about Glargine is that it's a long-acting insulin and it remains in the body for 24 hours. This is due to the reason that it is soluble at an acidic, or it's an aqueous at an acidic form at the pH of 4. And when we inject it to the body, we are injecting it into an environment of a pH of 7.4. Thus, when you inject an acidic compound into a basic environment such that of the blood, it results in precipitates. This neutralization occurs and results in precipitates. Those precipitates of Glargine dissolute slowly into the blood, giving it its long duration, which is 24 hours in the body. So the dose of Glargine when used for type 1 diabetes, the starting dose should be 1/3 of the daily insulin requirement, and the dose should be administered once daily at any time of the day, but it should be at the same time every day. And as we said, when we use Glargine for type 1 diabetes, we should use it with a short. One of the calculations that you might encounter is calculation the quantity that you should prescribe or you should dispense for Glargine. So let's say you get a prescription of Glargine 100 units per ml, and the dose is 12 units once daily for 30 days. So if 100 units are in 1 ml, how much ml do we need to get 12 units? Just cross multiply and the answer would be 0.12 ml. So the patient will need 0.12 ml daily. So for 30 days, for a period of 1 month, we multiply 0.12 ml by 30 and the answer is 3.6 ml. This is the total monthly requirement of Glargine by the patient. So 3.6 ml is enough for 1 month, and for example, we are dispensing this pre-filled vial. It's 10 ml, so one vial would be enough for an entire month. One of the main interaction of Glargine is its interactions with fluoroquinolones. These group of antibiotics have led to hypoglycemia and hyperglycemia in other patients. So when you administer them with a hypoglycemic agent such as Glargine, it leads to excessive hypoglycemia that have resulted in coma and death in some of the patients. Thus, when you are prescribing or dispensing Glargine, just make sure to avoid the fluoroquinolone groups. Glargine also interacts with ARBs and ACE inhibitors. These medications increase the insulin sensitivity and thus potentiate the hypoglycemic effect of Glargine. Also, the co-administration of Glargine with beta blockers have resulted in hyperglycemia. Thus, when we are giving the patient an ARB, an ACE inhibitor, a beta blocker, the patient should be closely monitored for hyperglycemia.